Are you experiencing hip pain, back pain, maybe even knee pain with walking or any other dynamic activity like walking upstairs or running? Or you have to have the perfect shoe or something just doesn't feel right? Your gait is one of the most powerful assessments of movement efficiency that we have. How you interact with the ground, so how you are taking in impact force and using that as energy, is so profound. And so we're going to dive in today about how you can think about your pelvic mobility and how it plays into your gait cycle, and some exercises to help you move on your way to better walking, dynamic movement, and even running if that's for you. Hi, I'm Dr. Ariane Missimer, and I'm a doctor of physical therapy, functional medicine practitioner, and registered dietitian, and I am super passionate about helping you move your best. So when we are walking, we are encountering 1.5 times our body weight in force. And so when we're running, we're encountering up to 3 to 4 times our body weight in force. And when we're jumping, it can be up to 8 times our body weight in force. So what that means is that we have to be really efficient about how we are interacting with the ground. And after doing probably thousands of gait assessments at this point, I've realized that there's some common themes, and one of them is something that is often ignored, which is pelvic mobility. We're always thinking about, what we need to stretch or what we need to strengthen, but we also want to think about how the pelvis is moving in our gait cycle, and we actually need proper rotation of the pelvis. We need side bending of the pelvis, and we need forward and backward motion. Any of these that happens to be too much, of course, is not going to be beneficial. Anything that is limited, that is not going to be ideal. And that can affect our stride length, how we are actually interacting with the ground, how much impact force is coming through our body, and so on. So although there are so many things to talk about with gait, we're going to zero in on pelvic mobility today. So for example, Kim et al. Showed that in chronic stroke patients that an anterior pelvic tilt, so think of your pelvis as being forwardly tipped, that it affected balance and it affected asymmetry. So just these simple little things can really have a huge impact on our overall function. So number one for our first assessment is looking at pelvic mobility from the floor. Placing your hands on your hip, and you're going to forward bend. So you're tipping your pelvis forward, arching your back, and then backward bending. And we'll do that a few times. And really what you're doing initially is just assessing, do you feel like there's any discomfort? Are you able to have a smooth motion? Is there any shaking that's happening? Does it feel limited in one direction more than the other? Then you're going to move into side bending. So from here, side bending, bringing your hip towards your shoulder, back to center, hip towards your shoulder, back to center. So of course this can be an assessment, and it can also be an exercise. So as an exercise, you want to think about focusing on your breath. So breathing in and breathing out as you flatten your back. If you're doing the side bending, breathing in, really that nice diaphragmatic breath, and exhaling, coming into a side bend. Once again, seeing if there's symmetry between the sides, or if one feels perhaps painful or crampy. All of these things are really relevant. Number two is going to be to come up into a table position, and you're going to perform the same exercises from here. So you want to think about initiating from the pelvis, not from the upper back. So as I go into my forward bend, tilting the pelvis forward, and then as I go into the backward bend, tilting the pelvis backward. So once we pair that with the breath, breathing in, tilting the pelvis, abdomen expands, exhale, tilting the pelvis here. Moving into side bend, you can think about that same motion. It's almost like it's called wagging the tail. So you're looking here, breath in, exhale, side bend. Seeing if there's symmetry side to side, if it feels restricted. All of this is important information for how you would perform the exercises. Number three is to begin to move into some pelvic rotation. So here I'm going to straighten my left leg, and I'm going to rotate the pelvis into the stable leg here. So it would be breath in and then exhale, dropping my pelvis into this hip and then bringing it back up. So breath in and bringing it back up to neutral. Switching sides so you can see it from here. So extending this leg, keeping the left leg stable as I drop this right leg in and then back up to neutral. This really helps to work on rotating the pelvis into a stable leg. And number 4 is going to be a standing exercise. So we'll start on the right side. This leg is going to be back. This is called the airplane. So working on, once again, stable hip here, and then moving the pelvis into the stable leg. So right now I have this leg kickstanded and then back to center. So it can be breath in, exhale, bringing it back up. And then you can move to single leg and do the same thing. So breath in and exhale as you bring it back to neutral. Really tough exercise. I'd recommend working on all of the others first and then progressing to this. So all of these exercises can be really powerful in making a difference in your gait and how you're interacting with the ground. So I recommend performing these in order, making sure you're able to do the first level exercises before progressing to the standing. And of course, these can be integrated into a full comprehensive program of strength and stability and mobility, but it can make a really big difference in your overall gait. And if this was helpful, please make sure to like, follow, and subscribe so that you can see more videos on how to improve your health through mindset, nutrition, and movement. Thank you as always for joining.